I'm Dr. David Little. I'm private practice in San Antonio, Texas. I have a multi-specialty office. I'm also adjunct clinical professor at the dental school here in San Antonio, and I also serve as clinical director for Little Implant Company. I was in San Antonio when Nova BioCare brought implants to the United States. They went to New York, LA, and San Antonio. So I've seen it from the beginnings of where we are.
And how's it changed?
Oh, dramatically. Just from a time standpoint, from a material standpoint, from a technique standpoint, we constantly improve. And one of the things, though, that we always have to look at is we still have a 10% failure rate, with that. And we also see and the more I've been doing this, the more I see effects of peri-implantitis. And so, we can see studies that say that 50% of implants have some form of peri-implantitis. So that's why I'm excited about this product, because if we can prevent that and help maintain it, we're going to have better health.
One of the reasons why they need implants in the first place is probably, well, a lot of them, is they had poor home care. Is that correct?
That's correct. So, I have a saying, so if they didn't take care of their teeth, what makes me think they're going to take care of their implants? And I say there's two reasons why. One is that now they're investing. And so I tell them we want to do everything we can to protect that investment. And so you have to start with maintenance from the beginning and to get them on board. That's the other thing I really like about the OraCare implant therapy kit is that, not only do we do something at the site to prevent that, but we also encourage them to start rinsing immediately, and then we can maintain it for a long time. And, that's a really big plus and a really big part of success.
So tell us the results that you see from OraCare versus maybe a non-OraCare case. What's the, what did you see before you start using OraCare, and what do you see now?
Well, I think the biggest thing, and even, my periodontist that I work with, Dr. Pamela Ray, she's very picky about tissue, and, rightfully so. And when she tried it, she came back to me and she goes, "Oh my God, the tissue is so much healthier when I go back to uncover on second stage." And she noticed that the continued use by the patient makes a big difference. And so it's the combination, I think, that makes a big difference.
Why is the gel important?
Well, again, I go back to that prevention. So anything we can do to help the healing of that implant. And again, what are we trying to do? We're getting rid of bacteria, fungi, breaking down volatile sulfur compounds, breaking up biofilm, whatever we need to do to get that as healthy as we can. And obviously the rinse works great, but the gel is about 3 times as strong. So we're concentrating that right in the area where it matters most. And then we follow that up with the rinse. So I think it's the combination that really makes it successful.
What's the main thing about the rinse?
So, there's two things. We all know, and it's real easy to see the results of what, the rinse can do. It's a given, from that too. But more importantly, by packaging in the kit like it is, it reinforces that, this is a team approach to get success. And the way we have to do this, we have to start off with following up with the rinse. And the rinse gives them 34 days worth of rinse, which is, the studies show us that's the ideal time to make sure we do the best treatment that we can. And then because they get good results, they continue to use it. And so that promotes the health long term. So
you've seen patients transition from the implant rinse to the regular rinse.
And constantly. And again, I tell them, if you made an investment, you did get the best industry has to offer, especially on these big cases where you're doing total implants. Say, you know what, you're getting the best industry has to offer, and you've made a significant investment. So we need to do everything we can to protect that investment. And so ongoing, that's what we need to do to keep it healthy.
So you teach other dentists how to place implants. Who is this rinse for? Is it for general dentists? Is it for periodontists? Is it for oral surgeons, prosthodontists, or all of the above?
It's definitely all of the above. And, my focus is, I focus more on the GPs. I teach GPs, but I also work with a lot of specialists too. And so all of us have engaged and seen what this can do, and especially my team. And so we just see what it's doing for our patients.
All right, finally, so if you're talking to someone that, has some questions about OraCare, how can they see you use it? What's the next step?
Yeah, well, and first of all, if you do come to any of my courses, you'll see it live because, I when I do courses and do live surgery, I do it just like I do it in my office. So you'll see me use it. And I also have some restorative patients come to the courses, so you'll see the results too. But also you can go to the OraCare website, and there will be some videos there available that you'll be able to take a look at that, and some before and afters. We're constantly upgrading that. And so that's probably the best place to take a look.
Well, Dave, thank you for your time. For someone like yourself to get on board with it, we're just we're very honored. So I just want to thank you for your time and thank you for your support.
And you as well.